forward in this journey.
Thank you, Dr. Jitika Dubal. Thank you very much. First of all, this is the first session of Gyan Ganga of this year. I hope I'm audible. Dr. Jitika, am I audible?
Yes, ma'am, you are audible, ma'am.
So in the first session of Gyan Ganga, I would like to welcome you all the students, all the Shishyas and Gurus in the series of our Gyan Ganga. And I would also like to welcome our first speaker of this year, Dr. Dash. बहुत बहुत स्वागत है सर आपका. सर ने बहुत अच्छा टॉपिक एक चूज किया है आम बात के ऊपर. आप सभी को ओपीडीज में डिफरेंट पेशेंट्स मिलते होंगे रिलेटेड टू आम बात, उसकी चिकित्सा, उसके लक्षण, सभी चीज पूरा निदान पंचक के बारे में सर आपको आज बताएंगे और इससे हमारे सारे स्टूडेंट्स को बहुत बेनिफिट मिलने वाला है. तो मैं सारे स्टूडेंट्स को रिक्वेस्ट करूंगी टू बी रेडी विद योर क्वेश्चंस. एट द एंड ऑफ दिस सेशन डॉक्टर जितिका will give you some time to raise your queries. But क्योंकि अच्छे से करना होता है तो I would request all the members to please raise your digital hands. क्योंकि सभी एक साथ बोलेंगे तो वर्चुअल प्लेटफॉर्म पे पॉसिबल नहीं हो पाता कि सभी के क्वेरीज ली जाए. तो आप सभी अपना डिजिटल हैंड रेज करेंगे, एक के बाद एक डॉक्टर जितिका सभी को चांस देंगे. डॉक्टर जितिका will be giving chance to every student for this question and answer session at the end. So Dr. Jitika, please start this session. Thank you.
Thank you so much, ma'am. We shall start the session. Now I would like to introduce our today's expert, Professor Dr. Narayan Chandra Das sir, who is going to throw light on some insights into the concept of AMAVATA. Sir has done BMS from Utkal University in 1975, MD from Kerala University in 1982, and PhD in year 2000. Sir has also pursued a diploma in hospital administration from Coimbatore. Sir has associated with government sector in various roles, recent being ex-principal KATS Ayurveda College and Hospital, ODISHA. Sir has professional experience of around 50 decades. Several PG and PhD scholars of different universities do the research work under your supervision, sir. Sir has received several prestigious awards, including FRAV in 2020 and Lifetime Achievement Award in 2024. Sir has attended several national as well as international seminars and conferences. Sir has also several books and journals published in renowned journals. Now I would like to invite Professor Dr. Narayan Chandra Das sir to proceed with the lecture. Sir, please, you may continue.
Sure. Okay. Swagatam to each and all to this event of Gyan Ganga organized by RAV. I am fortunate enough to be a part of this, and this is my fourth joining. This is fourth time I am joining as a resource person in this Gyan Ganga series. So before we proceed to our topic, so let me extend my gratefulness and thanks for giving me this opportunity to be a speaker in this opening ceremony. Because you see a little gap, again we are joining today for beginning of this Ganga series, and the opening day I am participating in the resource person. This is a high opportunity for me. I am grateful to the RAV team, to the director, Madam, and Honorable Triguda Ji Sir, being the president of RAV. So to all gurus is my namaskar, pranam, and my blessings to all the sisters who have joined in the session 2025 and 26 very recently. So let me, before we touch the subject, I must pray Lord Jagannath, Ilachala Nivasaya, Nityaya Paramatmani, Balabhadra Subhadrabhyang, Jagannathayate Namaha, Jagadananda Kandaya, प्रणोतार्थहराय च नीलाचल निवासाय जगन्नाथाय ते नमः। Om Dhanvantare Namah. So today topic, why I have selected such a topic. Already Madam has, Director has cited. This is a very good topic, AMAVATA. See, sakashtaha sarvaroganam yadi prakupito bhave. Sakashtaha sarvaroganam. So whatever diseases is affecting to the mankind, this is one of the most, see, Sakashtaha, very painful disease among the human population so far. I found, and all the rishis have found, and all the Vaidya gurus, they must have found in their clinic every day. Every day in each Ayurveda clinic, we must see a patient of AMAVATA. But there is some problem, either in identification, proper identification, or giving a correct prescription. So last time I had also the same talk on AMAVATA, the critical interpretation. I had delivered a talk. There are so many medicines prescribed under AMAVATA Adhikar, but there is some mistake, there is some wrong, there is some error in selecting the proper medicine. That also will come in this, but I will not touch much. So today I will just concentrate upon how to correctly diagnose a case of AMAVATA. There should not be any mistake, any wrong, because you see our treatment will be also erroneous if our diagnosis is wrong. And mostly I am in Ayurvedic practice for last 50 years. See, if I say I completed my graduation in 1975 and completed my MD from Kerala University in 81. And I will tell you a story. During my PG career, my post-graduation career, when we saw patient, and when I uttered the word AMAVATA, then my professor, late Sarda Amma Ma'am, she used to tell, why Dr. Das, why you are telling AMAVATA? Don't say AMAVATA. This is a case of Bhatrakta. So there is a confuse between AMAVATA and Bhatrakta. So in South area, usually the Vaidyas, the high profile doctors, they usually they say the Amavastha Bhatrakta is Ambat, which we call AMAVATA. In here in West Bengal, Bihar, Uttar Pradesh, Odisha, which we call AMAVATA, so that is probably diagnosed as Amavastha Bhatrakta. But certainly we are now rotting over this, and we are now searching over this. We are researching upon this. AMAVATA, it is mostly it is not confusing. There is confusion in our diagnosis. We are confused because we are remembering Shastra. We are not remembering Shastra. So therefore, I have now decided and to speak upon a topic which is most abundant in everybody's clinic. Every day they encounter a case of AMAVATA. So AMAVATA, its description, AMAVATA description is not, abundantly found in text. The only text that is Madhav Nidan or that is Madhav Kara, who have written a chapter that is an AMAVATA. And either if we search Charaka Samhita Brotrai, Charaka Samhita, Susruta Samhita, or Bhagavata, specifically with a designation of AMAVATA is not written anywhere. And rather, Charaka, Acharya Charaka, he has described this is under some Medha Vikara. So Medha Vikara, AMAVATA habit can be correlated. But with a specific designation, AMAVATA is not found. So in spite of that, its virulency, its incidence, its abundance is very frequent. Previously it was frequent, now also it is more frequent. So the as regards I will discuss and we shall discuss the AMAVATA particularly which is common nowadays among human population, irrespective of country, caste, and creed. And all Ayurvedic clinicians are oriented to the clinical features of AMAVATA during their clinical practice. But it is encountered best percentage among the musculoskeletal disease. I have not given percentage because it is yet to be evaluated. I am not getting it compared with modern knowledges, modern sciences, because modern sciences have they have they have already brought out the percentage of the diseases by virtue of the research. But Ayurveda is yet to say what is the percentage of AMAVATA among the human population. Next. See, this talk will be a four-tier deliberation. So, part one, I will speak on AMA, how AMA is formed, how AMA is responsible, and how it is added to, how it is mixed with Vata, and both together they proceed to form a disease AMAVATA. And second one is part two. This is identification of AMAVATA, how there will not be any error in identifying AMAVATA. Number three, part three, will be dealing with the management of AMAVATA specific to principles, because every diseases in Ayurveda envisages with the principles of treatment, and we should proceed, we should treat according the principles of treatment. We should not be deviated, as like in modern medicine also. So Ayurveda also similarly, we should not be deviated from principles of treatment. And number four, the part four is the last part, will be critical interpretation of different formulations prescribed in AMAVATA. So this is this part fourth. We may not see, it is a very vast topic. So let us now discuss what is AMA. What is first AMA? Next one. See how to interpret AMAVATA. So AMAVATA is a disease having two words, formulated by two words. So number one is AMA and number two is Vata. Then first of all, AMA. And what is AMA and how it is formed? Let us now describe. So AMA is uncooked. If we understand, it is AMA, Ushmana, Alpabalatena, Dhatu Madhyam, Opachitam, Tushtam, Amasragatam, Rasam, Amam, Prachakit. So this has been said in Ashtanga, and this is what is AMA. Our students should understand. So AMA means particularly if the food which we eat, if it is not properly cooked, so that opaka portion is AMA. And AMA, we can say AMA is a state, AMA is a state, AMA is a avastha, and AMA is a AMA is a avastha, and AMA is a some substances. Either AMA is a substantive thing, some substances which have been generated in our GI tract, so that is AMA. And number two is Ama avastha, ama situation, ama condition which prevails in our body due to formation of ama. Next. So this state is due to deficient biological fire, or it is digestive integrity inside stomach, renders sluggish digestion, leading to formation of undigested food material called as ama. The state occurs within amasha. Amasha. Aharasya rasaha saro jo no pakvam agni laghvat ama sangyasya labhate pahu vyadhi samasraya. This is in Bhavaprakash Jora Chikitsa. So you see, people usually understand Roga, people usually understand the Ammo can cause manifold illness in our body or in human systems. All our systems can be affected, can be suffered from diseases due to ama. So but today our discussion will confined upon ama with special reference to AMAVATA. And Rasadhatu, which is Sarabhaga of Ahara, when not completely transformed due to disease, is called ama, and it itself causes many diseases. Then amo is also defined. Dhattvagnibihi opakat amo iti uchyate. Amo is also defined as Dhattvagni deprivation. If see Agni, 13 types of Agni we all know. So Pancha Mahabhuta Agni and Sapta Dhatu Agni and Kayagni. So out of these, the Dhatu Agni in each, all 7 Dhatu Agni, wherever it may be, if Agni is defective, if Agni is deprived, if Agni is less, that will discuss how Agni is deprived. Then you see, then there is a possibility of disease. So number 1, at the level of Amasha, so at the level of Dhatu, and also in the level of Dosapaka. When there is generation of dosa, there is also formation of ama. So in 3 stages, then you see properties of ama. What are the properties? If that ama which is formed in the GI tract, what is its property? So abhipakvam asanjuktam durgannam bauvichilam sadana sarvagatranam amoiti abhidiyati. So abhipakvam, it means undigested. Asanjuktam, which is not assimilated with the body tissues. So whatever we eat, that is ultimately digested, and it is accepted by body tissues. When it moves through the systemic circulation, then it is accepted by different tissues with their homologous content. Suppose
Sorry, Dr.
Mansudhatu Ahara,
Narayan,
we are
your
taking.
presentation connectivity very poor.
Hello, sir. Am I audible?
Yes, sir, you
Your
are audible.
connectivity presentation very poor, not clear. I with
My voice is,
Brajbhushan Sharma from Meerut, UP.
Sir, there
voice
may
is not
be
clear.
network glitch at your place, Vedibit Bhushan, sir. I am able to see it clear. Please check your network. Yes,
I see
Dr.
some
Narayan
network
Okay,
Chandra
okay,
problem,
Das.
some network
okay.
problem.
Dr. Narayan Chandra Das,
Sir,
sir,
we are
please
audible,
continue.
sir. We are audible.
Okay. Abhipakvam means
Yes,
undigested.
we are hearing. Go ahead.
Asanjuktam, which is not assimilated with the body tissues. Then Durgandha, having bad odor. And Bahupichila, extremely sticky. And Sadhanam. Sadhana means it is fatigue all over the body parts. Next. Then steps of formation of Amo. How Amo is formed. Amo Annarasam Kechittu Molasanjam Prathama Dota Dustingba Kechitamam Prachakhyati. This is Madhavidan Amba. So ammo can be formed in three ways: from incompletely digested air. So our ahara, the food which you eat, it requires to be digested fully. If it is not properly digested, there is a possibility of formation of ammo. Number one. Number two, accumulated molasses, waste products in the body give rise to substances which are harmful to the body. You see, the molasses, so there are, you see, each dhatu undergo pack, and if that pack is not proper, so everybody we know, so ahar rasa successively it nourishes the advanced dhatu, and there is formation of mala also, apapitta malakhyasu prasveda natharomacha netravidita khuchang sneha dhatunang kramasya mala. So these are the mala we know. So these mala may not be proper. It may be adulterated with ama. Okay, number two. Then number three, dosa dushti. So you see dosa dushti. So there is generation, there is kapha, pitta, and vayu are generated in the event of digestion. So if Agni is alpabala, so there is also formation of ammo, and that is adulterated, that infiltrate to dosas and giving rise to dosa dushti. So these are the three stages where ammo can be formed. Then types of ammo. How many types? Amma, how many types? So number one is simply ammo. Number two is ammo rasa. Number three is ammo visha. What is ammo rasa? Amma, suppose we had lunch, and after 2-3 hours it is not digested, and we have taken another meals, something addition we eat. So there is a possibility of formation of amma. So this is, and the number two, amma rasa. Amma rasa means amma rasa, if persistently formed, mainly lead to AMAVATA, Hridroga. Amma rasa means that is formation of amma, and that is ahar rasa. It leads to formation of rasa dhatu. During the formation of rasa dhatu, this is also being improper, and improper, that is called amma rasa. In dhatu level, amma reaches to dhatu level, and the preliminary rasa is affected, and it is adulterated to the amma, which may precipitate hridroga, which may precipitate AMAVATA, which may precipitate raja yakhma, which may precipitate prameha. So similarly, you see, third one is amma visha. Amma visha, where amma visha is formed? So amma visha is formed. See, mithya ahar bihar sebi. Persistently, he is consuming mithya ahar and bihar. He does not, you see, Dina Charja, he is far away from Dina Charja. He is far away from Rutu Charja. This is Viruddha, he habitually eat Viruddha. So there is a possibility of Anna Rasa, which is like Visha Rupatam, which is just like Visha. So there is the possibility. Example is, see, Visuchika. Visuchika, this is an example. And the character of Amma-Visha is just like poison. Amma-Visha. So three types of Amma. Number one is Amma. Number one is Amma Rasa. Number three is Amma-Visha. Next one. See, this is now the references. This is now the references have been Charaka Vimamskanu 2. This have been, see, Visha Sandrusha Lingani Tat Parama Sadhyam. And this Visha, Visha, is very toxic to the body and is very toxic, and it is not, it is not treatable even. In Shastra it is said it is untreated, it is not treatable, and the consequence may become fatal. So why na ashukaritvat? It become ashukari, it is very prompt acting. That visha, that amavisha is prompt acting, damages to the organs, damages to different physiology in our body very quickly. So it is fatal. Then consequences of amo formation. So what will happen if amo is formed? There should not be formation of amo, but if at all there is formation of amo due to different regimes, what will happen? What consequences we may meet? You see, ahara nourishes, we know, ahara nourishes the body, ahara nourishes the dhatu, ahara nourishes the oja, ahara nourishes the bala, ahara nourishes the bhavna, etc. So only after properly digested by Agni, if it is properly digested by Agni, this is now possible. And being undigested, not able to nourish rasadhatus, so and subsequent dhatus. So here Agni is the main factor in the process of digestion. So concisely formation of Abu is only due to Jatragni Mandhya. And I must tell, we must understand, Amo is a consequence of Agni Mandhya. Amo is a consequence of Agni Mandhya. Agni Mandhya and Amo formation are the two simultaneous occurrences. See, we cannot say his Agni is good and there is formation of Amo. And there is formation of Amo and deprivation of Agni are together, and they are simultaneously carried upon in the body. So people usually ask, sir, if Amo and Agni Mandhya or Amo and deprivation of Agni are the sequences go together in the body, go simultaneously in the body. So people usually ask how Agni Mandhya occurs. Natural, it is naturally people will ask, student will ask, Amo form due to Agni Mandhya. So why Agni Mandhya then occurs? How Agni Mandhya then occurs? See, Agni Mandhya occurs. See, Charaka Chikitsa 15, it has been said, O Bhojanat, Ajitnati Bhojanat, Bishama Asanat, Asatmya Guru Sitadi Rukhya Sandushta Bhojanat, Vireka Bamana Sneha Vibhramat, Vyadhi Karsanat, Vyasakala Rutu Vasanat, Veganan Vidharanat, Dushyanti Agni Sandushtanam, Natat Pachati Laghopi, Apachyamanam Suptatvam, Jatanam Visarupata. It has been said in Shastra, in Charaka Samhita. So Agni Mandhya develops due to diet and lifestyle causes. We take faulty diet, we not abide Rutu Charya, we not abide Dina Charya, we not abide Ratri Charya, and we succumb to a condition of Agni Mandhya. Agni is deprived due to many reasons, out of which Apatya, Ahar, Vihar, and also Agni Mandhya occurs due to the medicos ourselves. By doctors also, this Agni Mandhya occurs. How? Na mithya, faulty application of Panchakarma. If we use Panchakarma in a faulty way, we do not avoid Purva Karma, we do not avoid paschat karma and pradhan karma properly. So there is also a chance of Agnimandya which have been documented in Shastra. So this is called iatrogenic diseases. This has been said in Shastra. And you see, people, Asatmya, Atiguru, Atishita, Atirukhya, Isamasan, Ajirna, Tushta Ahara, and intake Vidaya. You see, everybody is taking now Vidaya. Vidaya, I don't know, our students will naturally, they will ask, sir, what is Vidayi? So Vidayi Annapan is also regularly we take Vidayi Annapan. In we are now, you see, outside this, the food which have been served to the people in the in the markets, so that causes vidha. So vidai annapan means which is fried. Many times it have been hot and cold foods we are taking, and we are very small children also. Usually they are very fond of this, so they are taking. So this is also one. And mithya jog, ati jog, abhama, iracham, asti. So these that also may lead to Agni Mandya. Plus, hetus of Agni Mandya are also the hetu of Amu. Hetus of which is the hetus of Agni Mandya, that is also the hetu of Amu. And parts of body where Ama can create diseases. See, to our understanding, we are now discussing AMAVATA, and we take we conceive, we understand. So Amo can cause AMAVATA only. No, certainly not. See, Amo can do everything. Amo can do Rogaha Sarvepi Mandaganu. We have studied. Rogaha Sarvepi Mandaganu. If there is a sequence of Mandagini, there is also a sequence of Amo. And if that Amo is linked, if Amo infiltrate dhatus like Rasadhatu, Raktadhatu, Mansadhatu, and these molas like Mola Mutra Swedha, so there is a possibility of disease. See, Jatrasthamam Virujatamevadesam Visheshana Vikara Jati in Susruta Uttaratantra 36. Wherever Amo goes, there is a possibility of disease. Where it get lost, there is a possibility of disease. Not only Amavat, but Amavata is a prime situation. It is a prime situation. It is abundant disease in front of us. So we are discussing Amo and Amavata. Next. See, then Amavata, when Amma infiltrate to the dosas, see, it can even do when it is infiltrate Vata, so there is Vata-borne diseases. When it infiltrate Pitta, there is a possibility of Amala Pitta. When it is infiltrate Kapha, so there is a possibility of Sotha. So these are the so many due to Vata Pitta Kapha, there is a possibility of the Charaka Chikshastan 15. Next. Then now we talk to now the discussion over Ama, its formation, its consequences, we have talked. Now we have to discuss little bit regarding Vata, because we are now discussing AMAVATA. So AMAVATA, if we discuss, we know Nirukti, Tatra, Ba, Gati, Gandhana, Yaruti, Dhatu. See, what is Vata? What is Vata stands for what? Vata stands for Gati and Gandhana. Gati means movement and Gandhan means touch. So Vata is defined as concept of mobility and tactile sensibility in body. Whatever tactile sensibility, touch sensation and mobility is attributed to Vata. See, then as regards the Vata guna, Rukhya Lagu Sitaschala Khara Visada Sukma, these are the Vata guna. 7 gunas are attributed to Vata. We must remember, and it will come in future discussion which guna are particularly responsible for causation of AMAVATA. Next one. See, definition of Vata guna I have given. So, Jasya Dravyasya Shoshan Shakti sa Rukhya. Rukhya is attributed to Vata. So, Rukhya, what for Rukhya is attributed to Vata? Jasya Dravyasya Shoshan Karmani Shakti hi sa Rukhya. Then Laghu. Vata is a Laghu in nature. Jasya Dravyasya Langhani Karmani Shakti hi sa Laghu. Then you say Jasya Dravyasya Stambhane Karmani Shakti hi sa Hima, means Sita. Rukhya Laghu Sita, Sita. Then Khara. Khara means Jasya Dravyasya Lekhane Karmani Sakara. Sukha. Sukha means penetration. It can go to any minute part of the body. That is Sukha. And Chala, mobile. Mobile. Vata is mobile. Automatically it is mobile because it is having Chala guna. Next one. Then combination of Amma and Vata. See, I said in case of AMAVATA, there is a possibility of combination of Amma along with Vata first, not with Pitta and Kapha. If it is infiltrate Pitta, there will be some other disease. If it is infiltrate Kapha, there will be some other disease, not AMAVATA. AMAVATA is only possible if there is an infiltration or there is an acceptability of Vata with Ammo. With Ammo. Ammo invites, you see, Vata is now excited under 2 conditions as a principle. Under what are these 2 conditions? So one condition is Vata Vruddhi is possible either Marga Vrodha or Dhatukhya. Dhatukhya, when there is a formation of Ammo inside the Srotas, Annavaha Srotas, so there is an obstruction occurs within the Annavaha Srotas and there is existing Vata. So Vata is also being obstructed and it is come in contact with Ammo and Vata is now excited. See, the so-formed Amma mixed amalgamated with Vata. And due to Vata moves forward through the systemic circulation and get lost in the joint space. It so happened because why Vata goes to Asti? In case of AMAVATA, the Amma goes to Sandhi. Why it goes to Sandhi and causes AMAVATA? Why it does not go to other places? It goes to because Tatra Astini Stito Vayu. Tatra Astini Stito Vayu. Asti is the seat of Vayu, number 1. And Sandhi is the seat of Kapha. Everyone knows. We know. We studied in graduation. Asti is the seat of Vata and Sandhi is the seat of Kapha. And Amma and Vata together, they move to Sandhisthana only because Vata has a favor. Vata has a favor to move to his own abode, to his own place, to his own house. Asti is its own house. When it goes to Asti, then there it favors to move to Sandhi because Sandhi is Kaphasthanam. Shasaka Kapha is there within the Sandhi. And these Kapha and Amma having a quality of similar quality. That Kapha is Guru. Shasma Sweta Guru Snigdha Pichheda. So these are the guna of Kapha. Shasma Sweta Guru Snigdha Pichheda. These are the guna of Kapha. And you see the Amma, its character is Guru. And it is a Nana Varna. And it is Ati Pichheda. So it is a similar character with that of Kapha. Therefore, the Vata with Amma, they move easily to the, because people also usually ask, our students also usually ask, sir, why it moved Sandhistan? Why it did not move to other places? It only because I think it everybody now clear. Then you see there is a property of kapha and ama like Guru Pichla and Snigdha, and Bhatta is predominant with the Chola Guna and Sukma Guna. See two quality with the two quality. With all Rukhya Lagu Sita Chala Kharabisa, all gunas do not come forward in causation of AMAVATA. Only two gunas, two numbers of gunas attributed to Bata favors Bata to move to Sandhistan. So it is Chalaguna and Sukhi. Next one. Then now my part 2 deliberation is over. Now we have a discussion regarding Amo and Bhatta. Now we come to part 2. So in this part, we shall discuss regarding AMAVATA, how to identify. I said in my introduction, see, there should not be any mistake, any error, any identification. Which one is which condition, which symptom we look, we search, then we can tell it is 100% AMAVATA. So our treatment will be very important and people will never disappointed in doing some error in that treatment. See, we have to now understand when we are looking to a patient, because it is out of my 50 years experience. It is not a day or a year. It is now 50 years. I have come across many patients. So I must tell you, we don't run after the diagnosis of modern medicine. If we do modern diagnosis, our treatment principle will be wrong. Because we have to search out, first of all, what is Nidan? He had Nidan 7 or not. Without Nidan 7, without Samprapti, there cannot be a disease. You see, we know all Samprapti, what is Samprapti, what is Nidan. See, as regards to AMAVATA, there is no Purvargu. There is only no Purvargu, only that was important. So, in case of Nidan, number one, it is particularly Viruddha. Viruddha, he must have a see habit of Viruddha. Different type of Viruddha have been described in Shastra, like Viruddha Chesta, Viruddha Kala, and Viruddha Matra, Viruddha Sanjo. So all Viruddha are applicable in case of AMAVATA. And you see, number 2, there must be Agnimandya. Agnimandya must be there. So we discuss why Agnimandya, how Agnimandya occurs. There should be Agnimandya. Then there is a formation of Amarosha that will move to Kaphasthana, Vayu. Kaphasthana. See, in future, in further we will study, we will discuss what are the Kaphasthana. See, Kaphasthana, the principal site of Kapha, as we know, there is Ura, Shira, Ulama, Sandhi, Parva, Amasha, Rasadhatu, Meda, Prana, and Jiva. So these are the principal site of Kapha. And this is Nidan of AMAVATA. So wherever we see a case, we must at least inquire whether appropriate Nidan is there or not. Then next. This is Samprapti. Samprapti is very, very important because we unless and until Samprapti is there, so there cannot be a disease. Then you see, this is for good understanding. For a clinician to keep it in memory, it is most essential. We see Vata Pitta Kapher Bhuyo Dushita So Annajar Saha Sotansi Abhishanyanti Nana Varna Ati Bichara. These are the character of Amma. This we have already discussed. Then Janatyasu Dorbalyam Gauravang Hudayasata. So consequence is weakness, fatigueness, then guruta, heaviness in heart, And these Amma have been declared by Acharya, by our ancient clinicians. This is so-called Amma. In respect of AMAVATA, it is Ati Daruna. Ati Daruna means it is extremely violent. We should not take it very lightly. AMAVATA, we should not take it very lightly because it is a very pronounced phenomena. It is a very cardinal thing. It is a very disappointing situation that in particularly formed in case of AMAVATA. And Jugapat Kupita Vanta Strika Sandhi Praveshaku Stabdang cha Kuruta Gatram AMAVATA Sauchati. So which condition we shall tell AMAVATA? See, first of all, when a patient is coming, we suspect it is a case of AMAVATA. We must ask him which of your body part was affected first. See, the amma which is formed in the GI tract, first it moves to Trika Sandhi. So our student usually they must ask us to our gurus why it moves to Trika Sandhi. They have read it, but they must have forgotten. I must tell them the Trika is the seat of Kapha. Everybody must be knowing Trika is the seat of slash Avalamban Kapha. We have Kapha 5 types. Kapha Saitani Namani Kledanas Chapalamana Shlesaka Slesmana Sapi Tapaka Stana Vedata. So these Kapha out of 5 Kapha, one Avalamban Kapha is there lodged in the place in the site of Trika. So it moves to Trika Sandhi first. We must ask to the patient which of your joint affected first. Trika Sandhi, number 2. Then number 2, Stabdhata. Stabdhata. Unless and until there is Stabdhata. Stabdhata means the normal function of that part is deteriorated. Normal function of that part is now restricted. We must tell Stabdhata. Retarded, the retardation of the body function of the body part, then only we can call AMAVATA Sauchyate. Otherwise it is not called AMAVATA. We can go some other diagnosis like Vatrakta, Sandhivat, something like that, Urustamba, all these. But AMAVATA can only be declared if there is Stabdhan cha Kuruto Atram AMAVATA Sauchyate. It is declared to me AMAVATA if in this situation prevails. Next one. Then this is Samprapti. Okay, next one. See, primary characters in AMAVATA. What are the primary characters? Unless somebody has a primary character, there cannot be secondary character. Primary, all diseases which affect the human population, that must develop primary character. It is our ill luck. It is our primary characters. He may not come to the doctor. So primary character that has been lapses. That in primary character patient has tolerated. He did not report to the doctor. So thereby patient has come to secondary. But we have to inquire. Did you have? We by heart it, otherwise we cannot treat it. Angamarda, Aruchi Krishna, Alasya, Gauravanga Jura, Opaka Sunatanganam, AMAVATA Shalaklu. So these are the primary characters of AMAVATA described in Madhav Nidan. So number 1 is body pain. Number 2 is a lack of appetite. Number 2 is he is thirsty. And number 4 is you see Alasyavam, Gauravang, Guruta, heaviness in the body. Then there is a febrile onset. It is a fever, low-grade pyrexia. Some people, even Gangnath Senji, in Paptaka Sarira, who has written, he has said, Either there may be fever, there may not be. There is no high fever. In AMAVATA, there is no high fever, but there is a febrile onset, there is a low-grade pyrexia, and so there may be fever and swelling in the organ. The affected organ, there is swelling. Next one. Then clinical, but AMAVATA, there is two stages. Either it is a primary condition or it is a secondary condition. Secondary means it is advanced. Prabhuddha AMAVATA. It is Samanya AMAVATA and Prabhuddha AMAVATA. Patient may have come in Samanya Avastha or patient may come in advanced condition. In either condition, patient may come to us. He may have febrile condition for a long time, but advanced characters have developed. So this is also possible. Then why I said in my introduction, I said, Sakasta sarvaroganam yada prakupito bhave. Why you have selected? Why a Vaidya is very cautious? Why a Vaidya is to be very careful? He should bypass all the symptoms. Otherwise, he cannot treat it. Ayurveda is such. Ayurveda cannot proceed by bluffing. See, without bypass, so therefore, I always tell my students, you bypass everything, then only you will be a good Vaidya. Swakashta sarvaroganam yada prakupito bhavet hastapada shira gulpha trikajano urusandishu. These are the joint distribution which are affected in Amba. We have to look for his hasta. We have to look for his pada. Hastapada shira gulpha trikajano urusandishu. This we studied. See, 45 years back and 50 years back, we remember today. Hastapada shiragulpa trikajano urusandishu. These are the joint distribution affected. But so far, Bhatarakta, so Bhatarakta is different. Bhatarakta, Angulisandhinam, Angulisandhinam. First affected is Angulisandhi, either the hands or your foot. These sandhis are affected first, at most. But here in AMAVATA, all central joints or big joints, and there should not be error in our diagnosis. And what will be Sarujam Swatam? Here that is Angamardha in primary symptoms, Angamardha. But here in secondary, it is Ruja. Ruja and Angamardha is different. Angamardha and Ruja, the character of pain in Ayurveda have been described in different manner. Shula, this is also a type of pain. Rucha, this is also a type of pain. And so there will be Rucha and there will be Sutta. So it is an inflammatory pain. Pain with inflammation. Here in secondary condition we can appreciate. Then Sadesha Rujata Aptartham Vyabidha Iva Vrushchiki. So it is a scorpion bite pain. It is so severe. And so Janayat so Agni Dorvalyam Praseka Aruchi Gaurava Utsavaning Vairasyam Tahomcha. And Bahumutratam. I said due to Amo, so there is a possibility of Tosa, Dhatu, and Mala. So if there is Mutra is affected, there is a possibility of Bahumutrata. And Ukhu Katinata Shulam, Tatha Nidra Viparjam, Trut Chakti Brahmurchascha, Rudrahang Vid Vibodhatam, Jadyantra Pujanaham, Kostang Sanipatravan. You see, it is very painful. If it is Upadrava, if Upadravas are there, then it is very painful to treat. And patient may not get even a cure. Then there may be musculoskeletal disorders, there may be metabolic disorder, there may be neuropsycho disorders, there may be digestive disorders, manifold disorders will be there, even if cardiocirculatory disorders, there may be fibrosis, in the lungs, and there may be cardiac involvement, and there may be persistent kasha, there may be cough, there may be breathlessness. So manifold problems, there will be anemia. There must be anemia in case of this Pandu. And so many diseases, and pathological conditions we encounter in patient. Then dosic characters, pitat sadaho ragam sasulang pavananugam stimitam gurukanduncha kapadustam tamadisha. Next. Then see curability, as regards curability. So if it is ekadosanuga sadhya, it is didosaja, then it is sapya, and it is sarvadachara shuddha. If there is edema, generalized edema all over the body, so kuchraha sannipatika. This is in sannipatic condition. There may be shuddha, there may be edema all over the body. Consequence of an AMAVATA, this is incurable. Kuchra sadhya. Then now we are coming to part 3. This is very important. Part 3 is very important because we are now dealing with the treatment modalities. Treatment modalities, we see AMAVATA Chikitsa Sutra, we have to define. AMAVATA Chikitsa Sutra, we have to by heart. See, Longanang Swedanang Tiktam. Longanang Swedanang Tiktam. Diponani Kotunicha. Virechanang Sneopanang Dostayas Sama Maruti. Sandhya Badena Unuvasya Khyara Vasti Prasasata. So this is the principles of treatment. You see Longan. Longan means we know what is Longan. See, for Amo treatment, for Amodasa treatment, actually in Shastra, in elsewhere, there have been description of Apatarpan. See, Santarpan and Apatarpan Chikitsa is divided into 2 types. So one is Santarpan, another is Apatarpan. Apatarpan is divided into 3 types. So one is Longan, another is Longan Pacham, and third one is Dosa Vasajam. So these 3 are Apatarpan. Then regarding Longan, see 10 types of Longan. Chatus Prakara Samsuddhi, Pipasa Maruta Tapu, Pachanani Upavasasya, Vyayamasati Longan. These Longan are 10 types. The suitable Longan. Longan means not fasting. Longanang Laguvojanang Ba. So whenever we say you are a case of Amavat, he should advise either Lagu Bhojan or fasting. But how many days fasting? Patient will die. So we have to examine his bolo and we have to prescribe him how many days we have to. So usually I have seen in Kerala when I was during my study career. So whenever a case will come, either a joint disorder, they usually prescribe. We learn from there during our post-graduation. Longan is very essential. They give very less diet and 1 or 2 medicine along with some patching. Then here also I advise Longan Lagu Bhojananga Ba. Lagu Bhojan means suppose he is taking 2 chapati, we prescribe 1 chapati. And see, I am asking them, sir, how many I will take? Then here we are telling Beya, Bilepi, Kruta Okruta, like that also we can adopt. But anyhow, very Lagu Bhojan. Lagu Bhojan, that is in Patha it will come. And this Longan, number 2 is Shwedan. Shwedan means in Shastra it is said either Baluka Shwed, and here we are giving Baluka Shwed. And some people even say Baluka Shwed is not good. Baluka Shwed is not even good because, but here during our practice in Odisha, we prescribe this Baluka Shwed because Baluka is Mukhya. We require Mukhya Shwed. But people say if we give Shweda, then the Ama which is lost there, that will be dried up. That cannot come back again. That cannot come back again to the posters, so that can be poured out. So therefore, some people, but it is now a matter of research. But anyhow, in practice, we prescribe Baluka Shwed. We prescribe Shankara Shwed. Here, in our daily practice. Also, then use of Katu Tikta Rasa drugs. Katu Tikta Rasa drink, if we get a AMAVATA case, we must prescribe him Tikta Rasa. First of all, we must know the rasa is prescribed other than Tikta Rasa. We have 6 rasas. 6 rasas are there. Our ahara is potentiated with 6 rasas only. Madhura Lavana and Katu Tikta Kasaya. So out of these, 5 are restricted and only 1 is prescribed, that is Tikta Rasa. So among the Tikta Rasa food, we have Korela, bitter gourd. Bitter gourd is already in all his lunch and dinner and his breakfast, we prescribe Korela. And as regards leafy vegetables, the neem sack and methi sack and many other sack is available. They are bitter in taste. These are also given. And another thing, we are giving them javagu, pear, and that warm water, that also we prescribe along with some medicines that we will discuss later. And Deepam, stimulating, and Birachan also we give, but Birachan, although this is principle, but when and where we have to prescribe Birachan, we discuss later. Then Snehapan means, you see, people will ask like that, Snehapan Vidhi. Snehapan Vidhi. When we are doing some Panchakarma, we recommend Snehapana. So Snehapana have 4 type of disease, 4 type of doses. So out of 4 type of doses, see, it is not equal to that one. It is not equal to that one. So it is rather Snehapan means it is Eranda Snehapan. That is Eranda Sneha means Eranda Castral Sneha is given as a remedial resource in case of AMAVATA. For not Snehapana as we do in Panchakarma procedures. Then Anuvasam and Khyarabhasti. Sandhya Badena Anuvasya Khyarabhasti Prasasya. Khyarabhasti has a place. Khyarabhasti is usually prescribed in case of AMAVATA. This is principle. Then management in primary AMAVATA. In primary AMAVATA, suppose a patient comes, so he might have been in febrile onset, he might have been stabdhata, he might have been in pain. Suppose in AMAVATA with febrile onset, we should not forget one thing, one patron is alone is so efficient, so commonly prescribed in AMAVATA, that is everybody should remember, that is Panchakola Pacham. Panchakola Pacham. That is the first line of treatment, that is the appropriate drug, and that is the best suitable drug to the patient. There is no any adverse reaction, nothing that will take out the fever, and that will minimize his pain, that is minimize his stabdhata. It is a manifold benefit patient will be getting in case of AMAVATA if we prescribe. What is Panchakol? Pipali Mulla, Chabya Chitraka Nagara. So these are the Panchamula. Pipali Mula, Chabya Chitraka Nagara. Nagara means Shunti. So these 5 things are made to decoction and given to the patient for how many days? How many days? So Amapachana is to be recommended in primary AMAVATA at least for a period of 7 to 8 days, not more than that. If you give more than that, there will be perforation in stomach. I said you there are many diseases caused by doctors that we don't know, we have studied. So there is a possibility of also problems if we prescribe it more days than a week. So Mrityunjaya Ras, Mahasudarshan Bhatti. Everybody know Mahasudarshan Bhatti. Mahasudarshan Bhatti is very proficient in Amapacha. It is a detoxifying agent. It is a detoxification agent. Please go through the book Mahasudarshan Bhatti, Mrityunjaya Ras, Vaishwanara Churna. Vaishwanara Churna, it is Agni Deepak, Amapachak, Panchapal Pacham, and if there is Shula, we can prescribe the Shula Vajrani or Mokshan capsule, etc. Then she Swatha predominating. Suppose somebody has Swatha. Swatha is very pronounced, Swatha is very vigorous, and Swatha is mostly disturbing, and that is a troublesome for patient. Then we should prescribe Gomutra Haritaki. Everybody know Gomutra Haritaki? Gomutra Haritaki is a Khara Pradhana. Khara Pradhana. It is containing Khara. It is containing alkali. And Gomutra has a very good role in case of minimizing Shuddha. It is enhancing urination. It is antagonizing situation of Kapha. So this Gomutra Haritaki is very good. Then you see Punannava Gugul. Punannava Gugul is a habit. If he is having fever, don't give this. After febrile onset, fever goes away. This is the next step. If Sotha, then it is Gomutra Haritaki, then it is Punannava Gugul, then Agni Tundi, Vaishwanara Churna, and you see Maharashnadi Kashaya, and Gandharva Haritaki. Gandharva Haritaki, everybody knows Gandharva Haritaki. It is available, there is no other drugs in it, only Gandharva. Gandharva means Erandatel, and Haritaki means Haritaki. Haritaki. Then Haritaki and Gandharva oil, they should facilitate, expel the ama which have undergone Paka by our Amapachaka proceeding. And after this, we need to prescribe Virechan. This is Mridu Virechan, mild Virechan. And we can also prescribe, that is Yeranda Vartaka Yoga. Yeranda Vartaka. One Vartaka, one Brinjal. We prescribe in ODISHA. Vartaka means Brinjal, one Brinjal. So he has to boil it and 10 ml around the tail. He has to fry it, or you can simply mix and give it during your dinner. So that will facilitate expulsion of ammo from the body. So this is around the Vartaga, which have been said in text. Then you see, or if it is not possible, we can prescribe this Gandharva. But he is having Angamarda predominating Amavata. Angamarda, very severe pain. Brushika Gansamvat Vedana, what do you have to do? So we have to do, you see, Nirgundi Patta. Nirgundi Patta is available everywhere. Nirgundi Patta is very abundant. Nirgundi Patta and Lasun, garlic. 20 numbers of this here. Nirgundi Patta and 4 to 5 pieces of Lasun. Then you see Shunthi, 5 grams of Shunthi. 4 कप पानी में इसको उबालिए, इसको 2 कप रखिए, और 1 कप सुबह और 1 कप शाम. इसको 4-5 दिन देने से जो शूलों का अंगमर्द का, क्योंकि अंगमर्द इज प्राइम सिंह, अंगमर्द अरुचि तृष्णा आलस्यम गौरवम ज्वर, ये जो मैं बोला अंगमर्द पहला नंबर कंप्लेन है. तो पहला नंबर कंप्लेन को मिटाने के लिए ये हमारा दवाई अच्छा काम करता है. और दूसरा दवाई क्या देंगे, जो इनको बातो गजांकुश हम दे सकता है, बातो गजांकुश रस, चिंतामणि रस हम दे सकता है, वैश्वान और चूर्ण हम दे सकता है. और शूला वज्रिणी, you please go through the text. Shula Vajrini is recommended, is prescribed as per the test in case of Shula in AMAVATA. So Shula Vajrini is a very good drug. We should not forget. We can also prescribe in case of AMAVATA. And AMAVATA, it is said in 4 times you can prescribe. 1 tablet every 4 hours you can prescribe. 1 tablet every 6 hours you can prescribe. 1 tablet every 8 hours we can prescribe, no problem. So Shula Vajrini is a very popular drug. Everybody should remember. Then is next. Then you see digestive promotion in AMAVATA. In AMAVATA, one prime problem is digestive problem. So digestive promotion in AMAVATA. So one is very good drug is Ognitundi Boti. Ognitundi Boti, it is containing Pupilu, and Ognitundi Boti is very confidently prescribed to enhance his appetite, to promote his digestion, and Boishwan Orchunna is very good. Boishwan Orchunna is very good and a very appropriate drug to improve his digestion, to get back his Agni into. And Samira Gajakesari Bhatti. I don't know whether it is available or everywhere. Samira Gajakesari Bhatti in Odisha we are using. It is Odisha formulation. Odisha formulation. Samira Gajakesari Bhatti is text. And you see, Panchakala Pachan is also very good. In absence of fever also, we can prescribe Panchakala Pachan. We can prescribe also Sultigant. It is no problem. And Gandharva Haritaki also we can promote. Then specific viration in AMAVATA, because AMAVATA needs viration. Viration. As regards treatment, I remind you again, Vanganam Svedanam Tiktam, Pipanani Patunicha, Virachanam Snehapanam, Bostayas Chamamarti. Viration is a mode of treatment, and without viration, we cannot treat AMAVATA. So AMAVATA for a viration, we have to select many drugs. First mild, then if it does not work, then we can go also drastic. Then first of all, around Vartak is very good. And number two is around the tail, castor oil, we can prescribe. If that does not work, so we can go for Singhanath Gugul. Singhanath Gugul, that is also good. And around this Gandharva Haritaki, that is also very good. And if there is Amavastha, still does not go, then we have to give also Gomutra Pachan, Gomutra with Yarandatail. That is also, that we can also prescribe. Then you see, so these are the things we may think as regards Virachan, and if there is Koshta Vadha. Then management of secondary AMAVATA. Suppose there is secondary AMAVATA, I said, Sakashta Sabroganam Yadi Prakupito Bhave. So in severe pain like scorpion bite, so this is in Samira Gajakesari Bhatti, then Bata Gajankus Ras, Mahabata Vidwansini Ras, Samira Gajakesari Bhatti, Ognitundi Bhatti. Then you see Bahumutrata, Agni Dorbalya. In Agni Dorbalya case, if Agni is very weak, Agni is not improper, then we confidently prescribe Panchakol Pachan and Sobhagya Shuntikhan Modak and Agnitundi. And if it is, there is Bahumutrata, I don't know, Bahumutrata, very surprisingly, you please go through the text. All my dear students, Shishyas, today you go and read in Boishwan Orchunna, AMAVATA Adhikar, it is written, Bahumutrata have been indicated against Boishwan Orchunna, indicated by rishis. So Boishwan Orchunna alone we prescribe, then Bahumutrata will come down. No need of giving some other drugs. Then you see Nidra Nash. So in Nidra Nash, we have many drugs, and according to the severity, we have to choose the drug. But here I have cited, this is Jatamansi, Ashwagandha, Yatamansi, and Ashwagandha. Then some other drugs are available in the market also that we can use, but I have cited here Vitation. Vitation, that is a tablet. It is a very mild tablet. We can give one tablet VD, so that is also helpful in case of Nidranath. And Bidbadha, constipation. Constipation in Singanath Gugul. Singanath Gugul is always prescribed one tablet once a day. Once. Usually people out of curiosity or because all Ayurveda pills are prescribed twice, so they also prescribe Singanath Gugul twice. But they have to look for, they have to search the book. It is only prescribed once, that is in bedtime with a very small meal. After a small meal, we can prescribe Singanath Gugul. And in Kerala, that is also one oil. It is, I don't know whether it is available in other places. This is Nirgundi Eranda Toila. Nirgundi Eranda Toila. It is usually prepared in Kerala because my study career. But here also we are using in some. That is also very good medicine. That is a painkiller. Side by side, it is a skeletal muscle relaxant. It is a skeletal muscle pain killer, and it is also powerful. That is a forget. So Nirgundi Eranda Tailam. And that also we can use. Gandharva Haritaki we can use. Singanath Gugul once we can use. Next time. Then you see somebody has Rudgraha. Rudgraha. Rudgraha may be precipitated in future. We can anticipate that one. We should not forget a AMAVATA case is susceptible to cardiac involvement. So we should also be careful. In order to, as a protection, we must give Bata Gajendra Singh. Bata Gajendra Singh. That is a drug prescribed under AMAVATA, and we have to prescribe Vaishwanarchun. I don't know, Vaishwanarchun is also containing an indication for Rudgraha. Rudgraha, very surprising. Our rishis are very intelligent, and they have searched. Vaishwanarchun is also effective in case of Rudgraha. And Mahayogaraj Gugul is also helpful in case of Rudgraha. Then Jadyata. So Jadyata is a proliferative symptom of AMAVATA found in advanced condition. Then what deficit in function. And there is, then you see what we have to give. So number one is, don't forget Rasonapinda. Rasonapinda. Khanjanikari Ras. Batari Gugul. Batari Gugul, please go through. It is Shastra, it is said, if no other doctors, no any other doctors could be able to cure that the patient of AMAVATA, you can try with Batari Gugul. Batari Gugul is so efficient that is to be tried. And Bata Gajendra Singh and suitable Swedan. So we will go by Jadyata. Then you see Anaho. Anaho, it is a GI tract disorder, and Gandharva Haritaki, Gandharva Hastadi Kashaya, and Eranda Pak, and Kharavasti is also very appropriate and suitable. Then Pathya and Apatya indicated in AMAVATA. So Pathya and Apatya are very, very important. So there is a, you see, there is direction. Pathya Sati Gadartasya Kimo Sadhi Nisevani. Pathya Asati Gadartasya Kimo Sadhi Nisevani. So who is in Pathya? No need of giving in medicine. And who is giving Apatya? No need of giving medicine. So they are incurable. So Pathya means it is my advice. It is my, see, my sincere observation out of my practice. Then bitter taste, bitter food are very helpful. And Karavellaka, in Shastra it is said Karavellaka or Corella, or in English it is called bitter gourd. So give bitter gourd. And all other shaka, all other leafy vegetables which are bitter in taste, that is very good. Rasana every day, very good. Yaba, very good. And Adrak, very good. Jangal Mansa, very good. And who is non-veg? Suppose somebody is non-veg, he will ask us, sir, which non-veg I can take? So what will be answer? Answer will be, I think it is very poor answer we will get from many people. See, no, regarding non-veg, only which is bitter taste we can advise. So that bitter taste is available in Odisha, in West Bengal, in Bihar, in Uttar Pradesh, in South, everywhere. So that is available. That is called dry bitter fish. Dry bitter fish. The only dry bitter fish is advised. Anupa manso. Anupa means which are now you see, which are collected in you see. We cannot prescribe. We cannot prescribe anupa means fish. We cannot prescribe meat, chicken, egg. No, certainly not. So only non-veg, only thing that is dry, bitter fish we can prescribe. Okay? Then you see which you don't take. So number one is curd, number one is guda, then upadika, mishtanna, matsya, like khira, marsa, biri, black gram, and Begavarodha, Anupamansa, and Bhindi, lady finger. No. Next. Then this is my last part. So last part I must tell, this is the critical study. This is into my critical study interpretation on AMAVATA with its critical study. So this I have been on my second deliberation in RAV platform. I have already discussed, but within 2 minutes, I want to concise it. So one is this, there are many medicines described under the Adhikar of AMAVATA. So how to select? Because a AMAVATA case may be diabetic. A AMAVATA case may have Amlapitta. A AMAVATA case may be having Pandu. A AMAVATA case may be having Khanjata. A AMAVATA case may be having Raktapitta. So shall we prescribe 2 medicines? Shall we prescribe 3-4 medicines? Certainly not. Our rishis have cultivated, our rishis have cited all directions for us. Nothing we to be worried. So I shall cite the example. Suppose AMAVATA with Kushtha, AMAVATA with Raktadushti. What medicine we have to give? Patari Gugu. AMAVATA with Prameha. What we have to give? These 2 diseases will be controlled. AMAVATA, Prameha, both will be controlled. So Rasvana Pinda, not Bruha, it is only Bruha. 2 types of Rasvana Pinda. So one is Maharasvana Pinda, another is Rasvana Pinda. So only Maharasvana Pinda is prescribed in case of AMAVATA with the Prameha. Then AMAVATA with upper smart. Suppose he is an epileptic patient and he is a Unmada patient and having AMAVATA, what is the medicine? The Swalpa Rasvana Pinda, not Bruhat Rasvana Pinda. If Maharasvana Pinda, never prescribe. It is Rasvana Pinda. You please go and look to the indication. Rasvana Pinda is the indicated drug in AMAVATA with Apasma. Then AMAVATA with Pandu. He is having Pandu and Kamala, the anemia with jaundice. So we can prescribe this Triphaladi Loham. Triphaladi Loham. So Triphaladi Loham carry the indication of AMAVATA with Pandu and Kamala. Then AMAVATA with Bishama Jura. So Bishama Jura, AMAVATA with Bishama Jura, Bidanga Adi Loham. Bidanga Di Loham is the proper drug. And AMAVATA with Khanja and Pangu, Pata Gajendra Singh. AMAVATA with Amala Pitta, this Ama Gajasingha Modaka. Ama Gajasingha Modaka. And if he is Rakta Pitta, also the same Ama Gajasingha Modaka. And AMAVATA with a wide indication, with a very brighter indication, broad indication, we should not think anything. Ojomodadi Bhataka. Ojomodadi Bhataka. It is an appropriate term. So I think with this, I concise, I bring an end to my talk, and I am very grateful. I am very thankful giving an opportunity by RAV in this opening session, because it is an opportunity, it is an adventure for me. It is a subject of my choice, because in Odisha, AMAVATA is very, see, the incidence is very high, because it's an Anupadesha. It is mostly Anupadesha. And as like many places in our country, and Bhatrakta impact is very few. Bhatrakta is few, incidence is less than AMAVATA. So this is my I have tried my best to deliver it in proper manner. So anyhow, my big friends, my gurus are there. I extend my thanks to them for listening. And I end my talk here. And any questions, so any clarification needed, I invite you. Thank you.
Thank you so much, sir. We shall now begin the doubt session. Anybody if have any query, then you can ask away. You can also put that in chat box. I will raise that question for you. Or you can just raise your hand or ask directly by unmuting yourself.
Very, very thanks.
Any query among the students?
No thanks.
Thank you.
Okay.
नारायण जी बहुत बहुत धन्यवाद, बधाई। बहुत सुंदर आपने ओजस पर व्याख्यान दिया, इसके लिए बहुत बहुत बधाई के पात्र।
सभी को
नमस्ते सर,
बहुत
नमस्ते
बहुत
सर।
बधाई।
बहुत ही आपने विद्वतापूर्ण व्याख्यान दिया, लेकिन हम लोगों की विडंबना है कि अंग्रेजी नहीं आती। हम तो बिल्कुल जो है इस मामले में बड़े कमजोर हैं भाई।
नहीं सर, गलती तो हो गया, मैं हिंदी में थोड़ा प्रॉब्लम है बोलने में।
हाँ, बस थोड़ी हम लोग कमजोरी है, विज्ञान है, हम लोगों को ज्ञान बहुत ज्ञान इतना नहीं है।
डॉक्टर नारायण जी, वेरी वेरी थैंक्स, वेरी 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 थैंक्स।
राष्ट्रीय विद्यापीठ को बहुत बहुत बधाई, बहुत बहुत धन्यवाद। साधु, आप जैसे विद्वानों का व्याख्यान सुनने का अवसर प्रदान करती है विद्यापीठ हमको।
Thank you, sir. Thank you. On behalf of the organizing committee, I would like to thank Professor Dr. Narayan Chandra for delivering such insightful lecture. Next lecture in this series will be on 17th of April 2025. As on second Thursday, that is on 10th April, we have a holiday of Mahavir Jayanti. So the next lecture will be directly on 17th of April by Dr. N.N. Devan Nambudiri sir on concept of Shat Kriya Kalam. Now I would like to express my sincere gratitude to our mentor Padma Bhushan Vaidya Devendra Trigunaji sir, President Governing Body Member RAB, for his continuous support, guidance and blessings. I also thank our Director Ma'am, Dr. Vanna Surava Ma'am, who in the beginning of the session also joined us and guided us with all the proceedings. I would also like to thank Vaidya Rajesh Kutesha sir, Secretary Ministry of Fire, for his participation and encouragement in all our endeavors. Most importantly, I would like to express heartfelt thanks to all the gurus, shishyas and other scholars who with their presence and active contribution participation make this webinar a successful one. Jai Ayurveda.
Thank you, madam. Very very thanks.
नमस्कार ब्रिजस्टन जी को, नमस्कार शर्मा जी, नमस्कार
त्रिपाठी जी को नमस्कार, वाजपेयी जी को नमस्कार, मैडम को नमस्कार।
नारायण जी को नमस्कार।
Namaskar.
नारायण जी बहुत बहुत बधाई, नमस्कार। आपके दर्शन हुए इसी व्याख्यान के
नमस्ते
माध्यम
सर,
से।
नमस्ते सर, नमस्ते सर, नमस्ते सर। सर